So yes, hello everyone. So yes, am I audible? Is the screen clear so that we can start the session now? So yes, just let me check. Then we can start the session. Okay, so yes, it's audible. So yes, this is the target NEET PG 2022. So this is the anatomy session 1 where we will discuss the important MCQs related to NEET PG 22 examination. So let's start. Before that, I would like to give you the introduction about myself. Myself, Dr. Monalisa, and I have done my MD Anatomy from Armed Force Medical College, Pune, and I am an educator of anatomy subject on the platform of Unacademy. So yes, let me talk about the special class features which is present on the Unacademy, which is highly beneficial for you. So it's an interactive session where you can interact with the educators. Polls are conducted during the sessions and it is very important for a proper understanding. Raise your hands and get your doubts cleared. Okay, never miss a session. And how you are going to not miss a session, that is possible. Why? So how you are going to not miss a session? For example, if you start seeing the session, you want to follow that educator for notification regarding their sessions, whether it is on the free platform or on the plus platform. So if you start following that educator, for example, if you start seeing my session, you follow me, you will get notification regarding all my sessions on the Unacademy platform. So after completion of this session, you can also download the PDF notes. Once the session is finished, you can also download the PDF notes. So anytime, anywhere, read from the top educators of Unacademy platform. So these are the benefits which is on the special free platform of Unacademy. So just grab this opportunity. This is highly beneficial for you. So just grab this opportunity, my dear aspirants. I would also like to tell you about the plus subscription. So when we are talking about the plus subscription, you can access both live and recorded versions. You can study from India's top educators for medical field, compete in live tests and quizzes, and also study on the device of your choice. You can access more than 25,000 MCQs coming soon. Provided to you is if you are going to take the subscription of 1 year or more, you will also be provided with the printed notes of the plus platform of Unacademy. So all these benefits will be added up and it will be highly beneficial for you. So for taking the plus subscription, you can use this code and avail an opportunity of 10% discount. I would also like to tell you about the benefits of iconic subscription, where you get the benefits of two best platforms, that is the Unacademy live sessions on the plus platform and of the prep ladder. So already discussed about the live sessions of Unacademy, that is all 19 subject will be catered in a very systematic way. Other than that, what you can see that you will also get the benefits of prep ladder. So clinical integrated essentials, video lectures, QBank 3, rapid revision snapshots and treasure dream notes. All these can be catered by you, and what I suggest, if you are planning for your preparation and if you want to take the subscription, just go for iconic subscription, because here you are getting the benefit almost at the similar price. You are getting the benefit of two best platform. So just go for iconic subscription. My dear aspirants, I would also like to tell you about, I would like to show you this slide where the comparison of NEET PG subscription and iconic has been done. So you can have a comparison of iconic subscription with that of the NEET PG subscription, that is plus subscription. There is a comparison of the benefits and also the rates and pricing detail is there. So just go for it. And if you are a student of first or second year, go for the just go for 4 years or 3 years of subscription. Avail the opportunity of 10% discount by using the code NAT10. And if you are students of final year or pre-final, you can take 2 years of subscription or 1 year of subscription. My dear aspirants, I would like to give you the information where already the NEET PG iconic and the plus subscription are at a rate of discounted rate of 10%, and by using the code NAT10 another 10% discount. So that means a discount of greater than 20% can be catered by you. So just go and grab this opportunity, my dear aspirants. I would also like to tell you about the highly effective QBank, where more than 25,000 clinical MCQs of all 19 subjects can be catered by you and also can be solved by you, and you can also get a detailed description given to each and every MCQs by the top educators of Unacademy platform. So just grab this opportunity, use this code NAT10 and get 10% discount. My dear aspirants, I would also like to give you before starting the session, I would also like to give you the information of the batch course which has started on the Plus platform. The batch course which is started is Focus FMG batch and the Target NEET PG 2022 batch. So these are batches which is going on the platform of Unacademy. So just enroll in it, use the code NAD10 and get 10% discount. I would also like to tell that the comprehensive FMG batch is starting from the November end or first week of this December, and I am taking the entire anatomy in that along with the 19 subject. Entire 19 subject will be completed in a course of 6 months. So you can grab that opportunity, take the subscription, use the code NAD10 for 10% discount. Okay, so let's start with the session now. So let's start with the first MCQ of today's session. All the best to everyone, those who have joined. So let me read the MCQ for you. So for every MCQs you will get 15 to 30 seconds. So it's nothing that I will explain each and every MCQ is also the positive and the correct answer along with why the other options are incorrect. So let's start with the first MCQ. A soldier complains of foot pain following a 85 kilometer mountain climb. Upon examination, the physician diagnoses tendonitis of the fibularis longus tendon. So please note down which muscle tendon is involved. Fibularis, peroneus longus tendon is involved. Because of the tenderness is located deeply in the sole of foot, it appears that irritation occurs where the tendon lies against the bone, and it is covered by which of the following structure? It is covered by which of the following structure? So that is plantar aponeurosis, long plantar ligament, short plantar ligament and tendon of tibialis posterior. So my dear aspirants, you have got 4 options and mark the correct answer. So the key point is that the affected muscle tendon is peroneus longus muscle tendon, and the tenderness is located deep in the sole of the foot, and it is due to irritation of the tendon and is lying against the bone. So it is covered by and it is closely related with which of the following structure? So 4 options are there and mark the correct answer. Your time starts now. So those who so try to mark it. So the hint is provided itself in the MCQ. The hint is provided itself in the MCQ. So yes. So the important point is that the muscle tendon which is involved is peroneus longus muscle tendon. Which muscle tendon is involved? Peroneus longus muscle tendon is involved. Okay, fibularis longus. And we have to see that irritation has been occurred where the tendon lies against the bone, and at that level it is covered by which of the following structure? My dear aspirants, the correct answer here is long plantar ligament. And let me explain why long plantar ligament is the correct answer. So as we see the peroneus longus muscle tendon, it will enter the foot from the lateral side, from the lateral aspect. As we know, peroneus longus brevis, these are the muscles of lateral compartment of the leg. So it will enter the foot along the lateral aspect. Then it arches over the foot and get inserted into the base. Actually, there is a long course of peroneus longus muscle tendon. It will insert onto the medial cuneiform and also goes till the level of the base of first metatarsal. So what does this mean? This means that it is having a course traversing from lateral side and then reaching the medial aspect. So this is very important. And when you will see the long plantar ligament, it lies directly over the tendon. So there is a relation between fibularis longus tendon and that of long plantar ligament. So they are closely attached to each other, and the long plantar ligament lies directly over the tendon. Which muscle tendon? Peroneus longus muscle tendon. So the correct answer will be long plantar ligament. So let me write this relation. This is important for you to know. So all of you please write this relation. This is important for you to know for answering the correct for answering this MCQ. So we know that fibularis, which muscle tendon was affected? Fibularis longus muscle tendon was affected as shown in the MCQ. It enters the foot. So what is the course? How it is entering into the foot? It is traversing in the foot from the lateral aspect. So it enters the foot on the lateral side, and thereafter then it arches. Thereafter it arches across the foot to insert. What is the insertion point? It inserts, it will go towards the medial aspect and it will insert. It will traverse onto the medial aspect and it inserts. So please write down, it inserts on medial cuneiform bone plus the base of first metatarsal, base of first metatarsal. So this is the whole course of the fibularis longus muscle tendon. This is the whole course of fibularis muscle tendon, okay, traversing from the lateral side and enters till the base of first metatarsal and medial cuneiform. Now, the next important point which will give us the right answer is that the long plantar ligaments lies directly over the muscle tendon. Which ligament? The long plantar ligament. The long plantar ligament is located or lies directly over the muscle tendon. Which muscle tendon? Fibularis longus muscle tendon, over the fibularis longus muscle tendon. Okay. So this is the reason that long plantar ligament is the correct answer. Okay, actually the long plantar ligament connects the deeper aspect of the calcaneus bone and the cuboid bone and the base of the lateral 3 metatarsals. So what is the whole course of long plantar ligament? So write down long plantar ligament connects, you can say connects, or you can say it lies it connects the deeper structure and forms a connection. It connects calcaneus with the calcaneus heel bone with cuboid bone with the base of, and also with the base of 3 lateral metatarsals, 3 lateral metatarsals. So this is whole the course. So, and we know that when, so if there is a region of inflammation of peroneus longus fibularis longus muscle tendon, it will lead to the affection of, long plantar ligament. So long plantar ligament is the correct answer. So this is the reason long plantar ligament is the correct answer. Now let me show you a diagram for it. What I told, that long plantar ligament traverses from lateral side. So let me, and also no, firstly peroneus longus muscle. So let me show you the peroneus longus muscle and long plantar ligament also. So here you can see this is the long plantar ligament, which is a connecting the deeper aspect of calcaneum and the cuboid bone and also the lateral 3 metatarsals. So this is the attachment. This is on the deeper aspect of the sole. And as you can see, it is also lying on the lateral aspect and close to it the muscle tendon. So here you can see, again you can see here the tendon of peroneus longus muscle is also traversing onto the lateral aspect. So clearly we can see peroneus longus muscle tendon will be closely connected to long plantar ligament. Long plantar ligament. So when there is inflammation of, when there will be inflammation of the peroneus longus muscle tendon, the long plantar ligament can be involved. So that is the reason that long plantar ligament is the correct answer. Okay. So what about the other options? So what about the other options which is mentioned? The other options which is mentioned. So let me move with the other options. So yes, we have done with the correct answer. Now I would like to give you a brief about the other options which is mentioned in the MCQ. So let's move. Okay. Okay. So the options are, clearly we are now understanding why long plantar ligament is the correct answer. No doubt about this. It is clear that the long plantar ligament is the correct answer. Now moving on to the incorrect option. So plantar aponeurosis. One of the reason is plantar aponeurosis. So why plantar aponeurosis is the wrong option? Why? The reason is plantar aponeurosis is very superficial structure. Okay, actually it is covering the sole aspect and it is protecting the plantar nerves and vessels, but it is superficial structure. So it is a superficial in location. It is superficial structure. It is a superficial structure that protect the sole and it is not connected with the deeper structure. So it is not the correct answer. So it is not closely related with peroneus longus because that is deeper structures. Now coming to the short plantar, why short plantar ligament is not the correct answer? What is the other name of short plantar ligament? It is also called as calcaneocuboid. It is also called as calcaneocuboid ligament. So actually yes, You can get confused, but it is also connecting the lateral aspect of the, it is also lying on the lateral aspect and connecting the calcaneum, heel bone and the cuboid. But the course is short, as you can see. Long plantar ligament course is much longer and is going towards the base of the 3 metatarsals also. So that is the reason it will be not the correct answer. Okay. So yes, tendon of tibialis posterior, the other option, that is tendon of tibialis posterior, is also the wrong option which is given, and the reason is that if you will see the tendon of tibialis posterior, it enters the foot posterior to medial malleolus. What is the course of tibialis posterior? The reason why tibialis posterior is the wrong answer, because tibialis posterior muscle enters the foot. It enters the foot. What is the course from the medial aspect? It enters the foot traversing or traveling, you can say traversing or traveling posterior to medial malleolus, posterior to medial malleolus, and inserts on navicular bone. It inserts on navicular bone. So my dear aspirants, it inserts onto the navicular bone and also goes towards the medial cuneiform and metatarsals, that is 2 to 4. So actually this is the reason that it is, so one of the basic reason not being the correct answer is traversing towards the medial aspect. So, so in this category we know that fibularis longus tendon is lying traversing from lateral aspect, same as the long plantar ligament. So B is the correct answer. Let's move on to the next MCQ, that is MCQ number 2. All the best to everyone. Okay, which of the following is true? Which of the following statement is true regarding which of the following statement is true regarding suprarenal gland? Which of the following statement is true regarding suprarenal gland? So we have got following 4 options and you have to mark the correct answer. Option A is posterior surface of left suprarenal gland is related to kidney. Posterior surface of right suprarenal gland is related to inferior vena cava. Lateral border of left suprarenal gland is related to left gastric artery. Lateral border of right suprarenal gland is related to right ciliary ganglion. Okay, 4 options are there and you have to mark the right answer. Question number 2, mark the correct answer. So what is the correct answer? So we have to see the most important relation and which is correct in relation to suprarenal or adrenal gland. So we have to mark that as the correct answer. So my dear aspirants, here the correct answer in this respect is posterior surface of left suprarenal gland is related to kidney. So we have got A as the correct answer. So my dear aspirants, I would also like to give you the important relation which is very important in relation to suprarenal structures and their relation and the structures which is lying very close to the relations of both the suprarenal gland. I would like to brief you about that. So here option A is correct and let me again come up with the explanation. So when we are talking about the posterior surface of left suprarenal gland, it is related to kidney and it is also, so on the posterior aspect it is related to kidney on the lateral aspect and it is related to left crux of diaphragm on the medial aspect. So important relations, if we are talking about important relations, so it is important that you should know the important relations. So I will cater that point. So let's start with that. So firstly let me write it and then I will show you the diagram for it. Left suprarenal gland is related to kidney. Left suprarenal gland. So which part of left suprarenal gland? That is also important. Posterior. Please note down. Posterior surface of left suprarenal gland is related to kidney. Posterior surface of left suprarenal gland is related to kidney.
I didn't get that. Could you try again?
And left crux of diaphragm medially. Got it? So that means this is an important point for you to know. This is the first point which I want to cater here, that the posterior surface of left suprarenal gland is related to two structures, left crux of the diaphragm medially and that of kidney laterally. So this is the relations of the posterior aspect of left suprarenal gland. So this was the correct option which I have marked. Now if I talk about the next point, that is the posterior surface of right suprarenal gland. So posterior surface of right suprarenal gland is related to right crux of the diaphragm. So write on posterior surface of right suprarenal gland is related to right crux of diaphragm. So in short, we have done the posterior surface relation of both the right and the left suprarenal gland very nicely, and I would like to show you the diagram for it. Now coming to the anterior surface, when I am talking about the anterior surface of right suprarenal gland, when we are talking about the anterior aspect of right suprarenal gland, it will be related to inferior vena cava more medially. So yes, right on the third point, anterior surface of right suprarenal gland is related to inferior vena cava if it moves more medially, means in the more medial relation. Okay. Now moving on to the fourth point, lateral border of left suprarenal gland. If we talk about the relation of lateral border of left supra gland, it is related to the stomach. And when we are talking about the lateral border of right suprarenal gland, it is related to liver. So write on lateral border of right suprarenal gland is related to liver. And medial border of right suprarenal gland, medial border of right suprarenal gland is related to right celiac ganglion, right celiac ganglion. So got it? So these are the important relations which has been shown you. This is the important relation. So I would also like to show you a diagram for it. All the important information. So here you can clearly see posterior surface of the left suprarenal gland related to kidney is clearly right. Posterior surface of right suprarenal is related to inferior vena cava is approximately, it's wrong. Inferior vena cava lies on the medial aspect. If we see the inferior vena cava, it is lying in relation of right suprarenal gland anteromedially. Lateral border of left suprarenal gland is related to left gastric is absolutely wrong. When we are talking about the lateral border of left suprarenal gland, it is related to stomach, and lateral border of right suprarenal gland is related to. So actually lateral border of, when we are talking about lateral border, it is wrong. It should be medial border, my dear aspirant. It should be medial border. So this is also wrong. This should be medial border. So all these relations also I have written. So now my dear aspirants, see this diagram. So what you can appreciate, the one point which is clear here, that when we are talking about left suprarenal gland, which is a semilunar in shape, and when we see the right one, it is pyramidal or slightly triangular in shape. So see here, let me outline this. This is the right and this is the left one, semilunar in shape, and you can see here it is related with the left kidney and also the left crux of the diaphragm. Here the right one is related with the right crux of the diaphragm. Now if I want to show you another diagram where, let me slightly enlarge it, you can clearly see the outline of right suprarenal gland and that of left suprarenal gland. Now again you can see the inferior vena cava. You can see here, this is the inferior vena cava, and you can clearly see the inferior vena cava is onto the medial aspect for the right suprarenal gland. Okay, inferior vena cava. Okay, so also you can see here, this is the left suprarenal gland, and this left suprarenal gland when we are talking about the left suprarenal gland, medial border will be related to the left gastric artery. Okay, left gastric artery. So it is closely related to the celiac trunk. So here will be the one of its branch, that is left gastric artery. So important, and you can see here upper aspect and posteriorly there is the corresponding part of the crux of the diaphragm. In the upper aspect, superiorly, in the upper aspect, so posterior aspect, these are the crux of the corresponding part of the diaphragm which is related. So yes, also you can see inferior vena cava is more closer to the right hand side, not to the left hand side. Okay, and it is lying medially, not laterally. So done with this. Okay, so let's move on to the next, that is question number 3rd. So yes, all of you so can give the answer, whether it is right and wrong, that is not important. So yes, question number 3, while exposing the kidney from behind, when we want to expose the kidney from behind, all of the following nerves are liable to get injured except. So we have got A option, lateral cutaneous nerve of thigh, we have got ilioinguinal nerve, we have got subcostal nerve, we have got iliohypogastric nerve. So question number 3, we have got 4 options and you have to give me the right answer. Okay, question number 3, that when we expose the kidney from behind onto the posterior aspect, which of the following nerve are liable to injure? Means all of the following nerves can be injured except, so which one of the following nerve is not lying in the posterior relation? So that is which, that is the correct answer. So you have to give me the correct answer among the options provided. Okay, so yes, I got an answer from fellow, A with a question mark, A with a question mark. So fellow is telling A with a question mark. So my dear aspirants, let me see of those. So yes, A, he has given A as the correct answer, and my dear fellow, you are absolutely right. So yes, you are absolutely right, lateral cutaneous nerve of thigh. Actually, lateral cutaneous nerve of thigh is not related onto the posterior aspect of kidney, and if we talk about the other nerves which is mentioned, actually ilioinguinal nerve, subcostal nerve, iliohypogastric nerve, all these nerves and also subcostal vessels are lying on the posterior relation. So it is important that we should know the posterior relation of both right and the left kidney. So let me write it for you and then I will show you the diagram. So write on the heading, posterior relations of both kidneys. Okay, so actually when we talk about posterior relation of kidneys, it's almost equal for, it's almost similar for right and the left side. So I will write the posterior relation of both right and the left kidney. So yes, when we are talking about important muscular structures, so you can say muscular structures which is related posteriorly, the structures are the corresponding part diaphragm and medial and lateral arcuate ligament, medial and lateral arcuate ligament. Okay, or directly muscles which is related posteriorly. So directly muscles which is related is psoas major muscle, quadratus lumborum, quadratus lumborum is related, transverse abdominis is related. Now if I talk about its nerves and vessels, so nerves and vessels. So if I talk about nerves and vessels, the structures related are subcostal vessels, ilioinguinal, iliohypogastric nerve, ilioinguinal nerve, iliohypogastric, and subcostal nerve. So these are all the relations on the posterior aspect. These are the relations, so muscular structures, then the muscles directly, and the nerves and the vessels. What about the ribs, dear? So I didn't mention the ribs. So ribs, you can just mention posterior aspect, the kidney. When I am talking about the right kidney, it is related to just 12th rib, and when I am talking about left kidney, it is related to both 11th and 12th rib, because on right hand side the heavy weighted liver is lying. Okay, so yes. So yes, fellow, you are absolutely right. Now let me show you a diagram for it. This is a diagram in which you can appreciate. So just focus on this diagram. So yes, clearly in this diagram you can see here that the structures related posteriorly is 11th and 12th rib for the left kidney and only 12th rib for the right hand side. The nerves related, the muscles from medial to lateral is psoas major, quadratus lumborum and transverse abdominis muscle. Transverse abdominis muscle. Okay, transverse abdominis muscle. Nerves related, subcostal nerves and vessels, iliohypogastric and ilioinguinal nerve. So this diagram is beautifully showing you the structures related. If I talk about the muscles related, so most medially is the psoas major muscle. Most medially is the psoas major muscle on the posterior aspect. Next is the quadratus lumborum muscle. And most laterally will be, this is the quadratus lumborum muscle. Most medially is psoas major muscle and most laterally will be the transverse abdominis muscle. This is the transverse abdominis muscle. So done. Let's move on to the next, that is question number 4. All the best to everyone. Okay. So let's move on to the next, that is question number 4. Okay. So yes. In a traffic accident, a 35-year-old male sustains a severe neck injury at the level of C6 cervical level. In addition to crushing the spinal cord, the left transverse process of C6 vertebra is fractured. So, which artery is endangered in this case, whether it is common carotid, whether it is costocervical, whether it is inferior thyroid or vertebral? Question number 4, you have to mark the correct answer. Traffic accident, 35-year-old male, severe neck injury, what is the level? C6 cervical vertebra. And you have to tell me what would be the structure endangered. So, I got an answer from Nivedita and fellow, both of them have given the answer. So, yes, the level, so here the hint which is provided is the level mentioned, C6 cervical vertebra mentioned hai. So, we have to understand which artery is actually. So, actually the correct answer is vertebral artery, and which is given by most of you, and you are absolutely right. Yes, the vertebral artery is actually traversing through the transversus foramina. Foramina transversum of the C1 to C6 cervical vertebra. So, when C6 cervical vertebra is injured, then there is a chance of vertebral artery being injured. So, that is quite clear here. We will also move on to the incorrect option. So, yes, clearly the vertebral artery travels through, as we know that it travels through, its second part travels through transversarium foramen of C1 to C6 cervical vertebra, C1 to C6 cervical vertebra. So, what is injured? C6 cervical vertebra is fractured or injured, so there will be vertebral artery involved. So, in this case the correct answer will be vertebral artery. Yes, dear, actually INICT, yes, it's quite similar. Yes, you are right, fellow. So, actually there is an overlap of MCQs nowadays, and the standard of NEET PG MCQs and all are very similar to INICT. Okay, so clinical aspect is correlated with the MCQs now. Okay, so we will go, so that the reason is that this is the level which is provided. So, vertebral artery will be ruptured. So, yes, all of you were perfectly right, my dear aspirants. Now, let me talk about, so I would also like to show you a diagram for this. So, everyone, can you see here? This is the and from the subclavian artery from the first part of subclavian artery, the vertebral artery arises. So, the first part of vertebral artery is located in which triangle? Can anybody tell me? The first part of vertebral artery is located in scaleno-vertebral triangle. Fellow, please explain parts of what, so yes, it is the, when we are talking about vertebral artery, dear, first part of vertebral artery is located, okay fellow, the first part of vertebral artery is located in scaleno-vertebral triangle, the second part is traversing, can you see here, this is the second part which is traversing through foramen transversum of the upper cervical vertebrae, the third part, so okay fellow, the third part, yeah, vertebral artery, yes. So, yes, the third part I am telling it, dear, The third part is lying in suboccipital triangle. The third part is residing in suboccipital triangle, and the fourth part will pass through foramen magnum. It will pass through foramen magnum present in posterior cranial fossa. So, the first part here, first part scalenovertebral triangle, first part scalenovertebral triangle, second part through the foramen transversum of the upper 6 cervical vertebrae, third part in the suboccipital triangle, fourth part is the foramen magnum. Thereafter, the two side vertebral artery will join together and will lead to the formation of basilar artery. Okay fellow, it will lead to the formation of basilar artery. So, this is the reason that we got the correct answer as the vertebral artery. What about the other options? Okay, why the other options are not correct? The reason why other, so common carotid artery is not correct. Why? We know that common carotid artery is a branch, in the right hand side it is a branch of brachiocephalic trunk, brachiocephalic trunk. In the left hand side it is a branch of arch of aorta, and they are not exactly residing at the level of C6 cervical vertebra. Costocervical trunk is a branch from second part of subclavian artery. It's a branch from second part of subclavian artery. It is also not residing at a much higher level, that is C6 cervical vertebra. Inferior thyroid artery, we know that inferior thyroid artery is a branch from thyrocervical trunk, and thyrocervical trunk again is a branch from first part of subclavian artery. So, none of this are residing at C6 cervical vertebra except the vertebral artery. So, vertebral artery is the correct answer. So, yes, let's move on to the next, that is question number 5th. All the best to everyone. Let's move on to question number 5th. Question number 5th. Okay. So, fundus of the gallbladder lies in an angle between, when we are talking about fundus of gallbladder, the fundus of gallbladder is lying in an angle between lateral border of rectus abdominis and the tip of 9th costal cartilage. So, what vertebral level is this residing? What is the vertebral level to which it is residing? Whether it is T11, whether it is T12, L1 or L2. Fundus of gallbladder lies in an angle between. So, your time starts now. Please mark the correct answer. Question number 5th. So, I got an answer from Srinath B. I got an answer from fellow B with a question mark. Okay. So, the key point which is mentioned here, I will come to the key point which is mentioned in this MCQ is fundus of gallbladder is the level which is mentioned, lying between the angle of rectus abdominis and tip of 9th costal cartilage. So, clearly it is giving, it's a fundus of gallbladder, then the tip of 9th costal cartilage. So, these are the levels which is corresponding to which level, whether it is T12, L1, L2 or T11. My dear aspirant, it is L1 level. Okay, it is the level L1. Actually, fundus of gallbladder, which is located in an angle between costal margin and lateral aspect of rectus abdominis, which is corresponding to the 9th costal cartilage, is corresponding to which plane? It is corresponding to which plane? Transpyloric plane. And we know that transpyloric plane is passing through L1 lumbar vertebra. What is the transpyloric plane? L1 lumbar vertebra. Okay. Actually, to be more specific, it is lying over the lower border of L1 lumbar vertebra. So, we have got C as the correct answer. Let me show you a diagram for it. So, can you see the outline here? So, let me show you. This is the outline of the liver which has been shown, and you can clearly see inferior aspect, this structure which you are seeing, which I will just use a green color to highlight it. Okay, let me use this green color. So, this structure I am talking about. So, this structure is the gallbladder. This structure will be the gallbladder. Okay. So, the fundus of the gallbladder is corresponding to which plane? Transpyloric plane. Can you see here? It is located on the inferior. It is lying on the inferior aspect and it is corresponding to transpyloric plane. Actually, it is important that you should know all the structures corresponding to the level of transpyloric plane. So, my dear aspirants, as the question is about transpyloric plane, so I would like to enumerate the structures lying at the level of transpyloric plane. So, quickly you also write along with me. So, write down transpyloric plane. important structures lying at the level of transpyloric plane. Important structures. Please complete the list of structures lying on the transpyloric plane. It is corresponding to L1 level. The structures lying on this level is the pyloric part of the stomach, horizontal part of the duodenum, horizontal part of duodenum, fundus of the gallbladder which was mentioned, neck of pancreas, fundus of gallbladder, tip of ninth costal cartilage. So, ninth costal cartilage tip, also hilum of kidneys correspond to this level, hilum of kidneys. Superior mesenteric artery originates here. So, if neck of the pancreas is located, if neck of pancreas is lying there, so my dear aspirant, behind the neck of pancreas there is formation of portal vein. So, formation of portal vein is also corresponding to this level. What do you mean by formation of portal vein? That is joining of superior mesenteric vein and that of the splenic vein. Superior mesenteric vein and that of splenic vein. So, joining of superior mesenteric vein and that of splenic vein. Okay, superior mesenteric vein or that of splenic vein. So, this is SMV plus splenic vein. So, any other thing which you remember is also located there. So, yes, also right and left colic flexor is located at this level. Also, root of transverse mesocolon is lying at the level. Root of transverse mesocolon is corresponding to this level. And cisterna chyli. Cisterna chyli is draining into thoracic duct at this level, and also conus medullaris is located at this level, lower end of the spinal cord, conus medullaris. Conus medullaris. Actually, lower border of spleen is also at this level. Lower border of spleen is also corresponding to this level. My dear aspirants, so you can see so many structures which I have mentioned. All these structures are lying at the level of transpyloric plane. So, all of you do remember this list is important and MCQs has been asked from this. Okay. So, my dear aspirants, do remember this, the level of transpyloric plane and the structures corresponding to this plane. Done? So, yes. So, now let us move on to the next, that is question number 6. Let us move on to question number 6. Which of the following is true regarding the cells of retinal pigment epithelium? Which of the following is true regarding the cells of retinal pigment epithelium? So, which statement is true about retinal pigment epithelium? The retinal pigment epithelium is mesenchymal in origin, are shorter at fovea than else in the retina, have intercellular melanosomes, forms the inner outer blood retinal barrier. So, which of the following is true? Means most, so which one, only one statement is true about retinal pigment epithelium and you have to give me the correct answer. Okay, great fellow. So, yes, what is the answer? Okay, so let me give the most correct answer. Most correct answer, Dr. Varsha Chauhan has given the answer. Most correct answer will be that retinal pigment epithelium is containing melanosomes. Okay, so most correct is C. Okay, yes, it is okay that retinal pigment epithelium is forming a barrier, that is blood retinal barrier, that is also partially right, but inner outer no, it is only forming the outer aspect. So, if we have to choose one, we will go with C as the correct answer. So, my dear aspirants, when we are talking about the retinal pigment epithelium, the cells of retinal pigment epithelium is not mesenchymal in origin. This is wrong. So, this first option is wrong. Why? It is, can anybody tell me? It is ectodermal in origin. It is not mesenchymal, it is ectodermal in origin. So, A option is wrong. So, A option is wrong. Now this C option is right. Why? Because this pigment is containing, so retinal pigment, actually retinal pigment is containing melanin granules. It contains melanin granules. So C option is right, that is having intercellular melanosomes. It is having melanin granules which absorbs the excess of the light, and this cells phagocytize the photoreceptor segment, and actually it is important for the storage of vitamin A. So it is important for the storage of vitamin A. So that is important for the storage of vitamin A. So that is important phenomena, and it is also important. Retinal pigments are also important for regeneration of photoreceptors. It is important for regeneration of photoreceptors and forms only the outer part. So this D option is wrong. Why? Because it is forming only the outer part. It is forming only the outer part of blood retinal barrier. It is just forming the outer part of blood retinal barrier, not the inner and outer. So have melanosome is perfectly right. Other, okay, B option is also there. So I would like to give you the information. Are shorter? No, my dear aspirants. When we are talking about the length, we know the retinal pigment epithelium, we call it as a cuboidal. But when we see the length of epithelium, it is taller at the level of fovea. So it is not shorter, it is taller at the level of fovea. So please write down, this is also an important information. Retinal pigment epithelium is taller at the level of fovea and becomes exactly, it goes flattened towards the periphery. It is more flatter towards the periphery. Overall, we just tell that it is cuboidal epithelium. Overall, we just use the word, it is cuboidal epithelium. So, okay, my dear aspirants, is it okay? Can we move on to question number 7th, all of you? So, let's move on to question number 7th. All the best for question number 7th. Which of the following ganglia is involved in what was the last point in transpyloric plane? Last point, transpyloric plane. Conus medullaris. This one, conus medullaris, the lower end of the spinal cord, conus medullaris is also at the level of L1. Okay, dear, conus medullaris, lower end, it also correspond to L1. So also you can see here, so let me just, you can just click, these are all important structures. Okay, right, left, colic plexus, root of transverse mesocolon, cisterna cali, conus medullaris, all these are at the level of L1. Is it okay, everyone? Is it okay, Dr. Varsha Chauhan? Formation of portal vein, superior mesenteric, hilums of the lung, hilum of the kidneys, both the kidneys. Okay, so we have done with the question number 6, and we have seen retinal pigment epithelium is ectodermal. So we have got the correct answer. Let's move on to the next, that is question number 7. Which of the following ganglia is involved? So I also want to tell everyone that tomorrow is Tuesday, and we will have the session tomorrow on the YouTube, that is nerves of upper limb. So I will take a session live on YouTube, nerves of upper limb, and after that I will follow it with a MCQ session related to the topic which I will explain. So I will take the session in the evening. I think I have dedicated the time of evening 7 p.m. I have dedicated, and from 9:30 p.m. there is a session of 1 hour 50 minutes of MCQ session. Okay, so you can continue seeing the theory part on the YouTube, and then I will switch the MCQ session on the special class. Okay, so all of you can use my code NAT10. Download the Unacademy app, use the code NAT10. This is my code NAT10 for unlocking the session. So firstly, download the app and then use this code and be present for special class of tomorrow. Okay, which of the following ganglia is involved in mediating pupillary light reflex? Whether it is ciliary ganglion, whether it is celiac ganglion, trigeminal ganglion, or pterygopalatine ganglion. So 4 options are there. Mark the correct answer. Question number 7th, mark the correct answer. So question number 7th. Okay, so I got many of the answers are coming up A. So many of the answers are coming up as A. Okay, my dear aspirants, so A is perfectly right answer, absolutely right. Yes, A is right answer. Actually, when we are talking about ciliary ganglion, it contains postganglionic parasympathetic neurons, and these neurons is supplying which muscle? It is supplying pupillary sphincter muscle, which is constricting the pupil, and also ciliaris muscle, which contract to make the lens more convex. Okay, this is an important information, please write down. Ciliary ganglion is the correct answer, and the reason is that why it is correct, because it contains postganglionic parasympathetic nerves. These neurons or nerves supply pupillary sphincter muscle, causing constriction of pupil, which constrict the pupil, and it also supplies, plus it also supplies ciliary muscle. Ciliary muscle contracts to make the lens more convex. It contracts to make the lens more convex. So this is the reason that A option is perfectly correct. Now what about the other options which is mentioned? Okay, ciliary ganglion. Why ciliary ganglion is not the right answer? Let's move on to the other option. Ciliary ganglion is the wrong option, and the reason is that ciliary ganglion is the wrong option. Actually, it's the location of ciliary ganglion is at the upper aspect of the abdomen, and it is sympathetic. It is sympathetic division of A. So it is sympathetic. It is not parasympathetic, it is sympathetic subdivision of ANS, and it is mainly supplying the digestive tract. It is supplying the digestive tract. So this is the reason it is not the correct answer. Why trigeminal ganglion is wrong? Trigeminal ganglion, which is also called as Gasserian ganglion, semilunar ganglion. So it is actually the ganglion, sensory ganglion of the fifth cranial nerve. It is located in the Michel's caves, which is located near the apex of petrous part of temporal bone. And this is containing sensory stimuli from the head and the face region, and provide innervations to this area, and also supplies. The trigeminal nerve is also involved in muscles of mastication. So this is not involved in any kind of involvement with the light pupillary reflex. What about the other option? Pterygopalatine ganglion. So what is the other name of pterygopalatine ganglion? It is also called as sphenopalatine ganglion. For example, trigeminal ganglion is also called as Gasserian ganglion. Pterygopalatine ganglion, sphenopalatine ganglion. And this is also a parasympathetic ganglion, which is located in pterygopalatine fossa. Where is the pterygopalatine ganglion located? In the pterygopalatine fossa. Actually, this is a ganglion which is related with greater petrosal nerve, which is a branch of facial nerve. Okay, and its axon project through the nasal mucosa, and it supplies to the lacrimal gland. So it supplies mainly to the nasal mucosa and lacrimal, LG for lacrimal gland. So we have got the correct answer. 7th ka correct answer, ciliary ganglion is the correct answer. Okay, my dear aspirants, let's move on to the next. That is it okay? Let's move on to the next. That is question number 8. Which of the following respiratory system component is derived from neural crest? Okay, so which of the following respiratory system components are derived from the neural crest? Whether it is endothelial cells, whether it is epithelium of primary bronchi, okay, or whether it is the laryngeal cartilage, or whether it is the tracheal gland. Question number 8, mark the correct answer. Which of the following respiratory system component is derived from neural crest? So yes, okay, so yes, B, which of the following respiratory system component is derived from neural crest? So let me come up with the answer. Actually, the correct answer here is derived from neural crest. So when, so actually the correct answer here is laryngeal cartilage. Laryngeal cartilage, C is the correct answer. So actually laryngeal cartilage is the structure. We know that there is laryngeal cartilages. We have got the 3 unpaired and the 3 paired one. The unpaired is thyroid, cricoid, epiglottis. The paired one is the arytenoid, cuneiform and corniculate cartilage. These cartilages are derived from neural crest, originally from the neural crest. Now, tracheal gland is not the right answer, and the reason is that tracheal glands are actually the epithelium of tracheal gland. These are all endodermal in origin. Endodermal in origin. Epithelium of primary bronchi. When we are talking about the epithelium covering of the primary bronchi, it is also not the correct answer, because epithelium of primary bronchi is also endodermal in origin. Endothelial cells, actually endothelial cells are made of simple squamous epithelium, which is present in the pulmonary linings, and actually these endothelial or simple squamous epithelium is derived from visceral mesoderm. These are derived from visceral mesoderm originally. So if we have to pick one, we will go with the correct answer, that is laryngeal cartilage. Laryngeal cartilage is the correct answer. Okay, dear aspirants, let's move on to the next, that is question number 9. While attempting to suture the distal end of coronary bypass onto, and what is the location of artery? Anterior interventricular artery. So what happens when the surgeon okay dear, so while attempting the suture the distal end of coronary bypass anterior interventricular artery, when interventricular artery is approached, the surgeon accidentally passed the needle through adjacent vein. So which vein is damaged here? So anterior interventricular artery is the key point which is mentioned. You have to see that which vein will be damaged, lying very closely associated with this artery. Question number 9, we have got following options: anterior cardiac vein, coronary sinus, middle cardiac vein or the great cardiac vein. According to you, which is the correct answer? Question number 9, mark the correct answer. So I got an answer from fellow, from Seema, Ali. What about others? So great cardiac vein is perfectly correct answer. Actually anterior interventricular artery. So when we are talking about anterior interventricular artery, it will traverse through anterior interventricular artery, which is also called as the LAD artery. It is traversing in the anterior interventricular sulcus and it runs along with the great cardiac vein. So my dear aspirants, firstly I would like to give you the important location of the arteries and the veins traversing along with it, and then I will show you the diagram. So write on. The first point, anterior interventricular artery, which is running in anterior interventricular sulcus. It is running in anterior interventricular sulcus. It is running in anterior interventricular sulcus. Along with it, the vein which is running is the great cardiac vein. The great cardiac vein is running along with it. Okay. Now moving on to the second option. Anterior cardiac vein. When we talk about anterior cardiac vein, actually anterior cardiac vein is running in the anterior aspect of the right atrium and drains directly into right atrium. So it is lying over the right atrium surface, and directly drain into right atrium. It not drains into coronary sinus. It is not draining into coronary sinus. The third point, coronary sinus. So when we talk about the coronary sinus, the large vein in which the most of the veins of the heart is draining, it is located in arterioventricular. Where it is located? It is located in arterioventricular sulcus. It is located in arterioventricular sulcus, and actually there it is having also the location of, actually when we will see the coronary sinus, exact location is arterioventricular sulcus, where many of the important veins, great cardiac vein, the small cardiac vein, the middle cardiac vein, oblique vein of the left, all these important veins are draining into coronary sinus. So it is located in arterioventricular sulcus, and it is formed by union of many important veins, great cardiac vein plus oblique vein of left atrium, and actually many important veins will drain into it, and ultimately it will drain into right atrium. So actually many important veins drains, okay, middle cardiac vein, also small cardiac vein, all these veins drains except the anterior cardiac vein and small veins, that is vena cordis minimi. Now middle cardiac vein, when we talk about middle cardiac vein, the middle cardiac vein runs in posterior interventricular sulcus. It is running in posterior interventricular sulcus, or posterior interventricular sulcus में which artery is traversing? Posterior interventricular artery is traversing. Posterior interventricular artery is traversing. So please note down, posterior interventricular artery is traversing. So yes, is it clear? Posterior interventricular artery is traversing along with the middle cardiac vein. What about the small cardiac vein? What remains? Small cardiac vein runs into coronary sulcus along with right coronary artery. So the fifth one, small cardiac vein runs in coronary sulcus along with right coronary artery, along with right coronary artery. So got it? So yes, in this diagram I just want to show you here the location of coronary sinus, oblique vein of left atrium, great cardiac vein, left marginal vein, posterior vein of left ventricle, middle cardiac vein, small cardiac vein. So can you see all important veins, that is so if I highlight this diagram, you can see all important veins, that is the oblique vein of left atrium, great cardiac vein, left marginal vein, posterior vein of left ventricle, middle cardiac and small cardiac, all is draining into the coronary sinus, and coronary sinus itself is opening in the interior of right atrium. Now other important veins, see here. In this diagram you can see the anterior descending or the lad artery, okay, anterior descending or the lad artery is running in the from the anterior aspect, it has been shown, this is will be the great cardiac vein running. Posteriorly, if you will see the posterior interventricular artery, along with it the middle cardiac vein will run. Right coronary artery के साथ small cardiac vein. So done, already I have told you the location, so just memorize that location correlation, because in the previous year what I have seen the papers, they have many times asked this important relation of veins and that of the arteries. So let's move on to the next question, number 10. Deltoid ligament is attached to all except, question number 10th. Medial malleolus, medial cuneiform, spring ligament, sustentaculum tali. Deltoid ligament is attached to all except, 4 options are there, and you just tell me the correct answer on which of the following landmarks deltoid ligament, which is the medial ankle ligament, is not attached. Your time starts now. Mark the correct answer. Question number 10th. Mark the correct answer. Okay, so question number 10th. Okay, the correct answer here will be medial cuneiform. My dear aspirants, actually when we talk about deltoid ligament, it is having two parts, superficial part and the deep part. This deltoid ligament, which is called as medial ankle ligament, superiorly is attached to medial malleolus. Okay, so superiorly it is attached to common structure, that is medial malleolus. What is medial malleolus? Lower end of tibia. So lower end of tibia, which is the medial malleolus, is forming the superior attachment. It forms the superior common attachment of deltoid ligament. Is forming superior common attachment for the deltoid ligament. Got it? Now, when it goes lower down, it diverges into four parts. Okay, three parts are superficial and one part is deep. So, lower down it diverges. So, lower down, please write down, lower down. Yes, lower down deltoid ligament. Lower down deltoid ligament traverses as superficial part which is having three component, and deep part which is having one component, Actually the deep part is given the name, deep part is called as anterior tibiotalar. The superficial part is posterior tibiotalar, tibionavicular, tibiocalcaneal. So, three parts are there. Let me show you a diagram, that would be better for you to understand. So, see here. So, here in this diagram, let me just highlight this diagram. So, we can clearly see the medial ankle ligament, that is the deltoid ligament. What I told you, superiorly it is attached to that is medial malleolus. When it goes lower down, it divides into four parts. So, let me firstly highlight its deeper part. Deeper part is called as anterior tibiotalar. So, this is the deeper part, this is anterior tibiotalar. This is the anterior tibiotalar, this is the deeper part. So, this is the deep part, one part. Okay? Now, what I told you, it diverges in three direction. It has got three components. So, let's talk about it is also forming posterior tibiotalar. So, posteriorly it is forming posterior tibiotalar. So, this is posterior tibiotalar. Now, it also lower down get connected with the spring ligament, navicular bone and calcaneum bone. So, if I see here. So, lower down, if this is the tibiocalcaneal part which is merging with the sustentaculum tali. So, see here, it is merging with the sustentaculum tali. So, this is the tibiocalcaneal part which is merging with the sustentaculum tali. This is and the other one part which I want to highlight here, this is the tibionavicular, which is merging with the navicular bone tuberosity, and also with the spring ligament. So, see here, this is plantar calcaneo-navicular ligament and this is the tuberosity of navicular bone. So, you can see it is merging with the tuberosity of navicular bone, this is the N for navicular bone, this is calcaneus bone, and this is the sustentaculum tali. So, clearly you can see the parts of deltoid ligament. In this diagram you can clearly see. So, my dear aspirants, now it is quite clear to you that it is not attached to, the medial cuneiform part. So, this is the right answer. All other options is giving attachment to deltoid ligament. So, we will go with B as the correct answer. Let's move on to the next, that is question number 11. Among the following, content of cavernous sinus is, among the following option which is provided, which is considered to be the content of cavernous sinus, whether it is maxillary division of trigeminal nerve, whether it is ophthalmic division of trigeminal nerve, whether it is trochlear nerve or internal carotid artery. Question number 11, which of the following is considered to be a content of cavernous sinus? Four options are there and you have to mark the correct answer. So, I got an answer from Seema Ali. What about others? White fellow, Okay, fellow, okay, dear. So, internal carotid artery is absolutely correct answer. Actually, when you will see a diagram, you can correlate. So, we have got importance like maxillary division of trigeminal nerve, ophthalmic division of trigeminal nerve, trochlear nerve. All these structures are the content which is lying in the lateral wall of the cavernous sinus, except internal carotid artery. Here, internal carotid artery, if you will see, it is the content which is lying inside. It is traversing through the cavernous sinus. So, D is the correct one. So, yes, now, yeah, so D is absolutely correct. My dear aspirants, I would like to show you a diagram for it where you can clearly see this relation. So, what you can appreciate here, that this is the lateral wall and in the lateral wall. So, actually two structures are going in through. So, let me just highlight this diagram. So, if you will see, this is the outline. This is the whole outline of the cavernous sinus which you are seeing, okay, this is the whole outline. So, in this outline, what you can appreciate, the structure which is going in and out, this is one artery and the other one is the nerve. So, this is the nerve. This is the nerve which is also covered. So, you can see here abducent nerve and that of internal carotid artery. So, two structures, abducent nerve and that of internal carotid artery is traversing inside, is going through and through the cavernous sinus. It is also the abducent nerve is covered by sympathetic plexus. Now, other than that, few nerves you can see from above to down which is located on the lateral relation or lateral wall of cavernous sinus. These nerves are oculomotor nerve, trochlear nerve, ophthalmic division of trigeminal nerve and maxillary division. So, oculomotor, trochlear, ophthalmic division and maxillary. These are the nerves which is related to lateral wall of cavernous sinus, not passing through and through to the cavernous sinus. So, we have, so internal carotid artery is the correct answer. Now, my dear aspirants, I would also like to share this image with you where you can clearly see the tributaries and communications, communications of the cavernous sinus. So, tributaries are from the orbit, three sources are there. From the orbit is the source, from the meninges is the source and from the brain is the source. So, when we are talking about the orbit, the source are three veins: superior ophthalmic vein, inferior ophthalmic vein and central vein of the retina. Okay. When we are talking about meninges, two tributaries are there: sphenoparietal vein, sinus and middle meningeal vein. From the, so actually from meninges, sphenoparietal, sinus, middle meningeal vein, and from brain is the superficial middle cerebral vein and inferior cerebral vein. The communications is via facial vein, pterygoid venous plexus, communication with basilar venous plexus, forms two-side cavernous sinus connecting with intercavernous sinuses, and these are draining channel, that is superior and inferior petrosal sinus. Actually, this diagram is very clearly showing you all the details, anatomy of cavernous sinus. You can appreciate the communication, you can appreciate the tributaries, direct tributaries of cavernous sinus, and this is showing the structures located through and relations of cavernous sinus along with the structures lying in the lateral wall. So, yes, done with this, my dear aspirants. So, yes. So, okay, before ending the session, I would like to tell the aspirants that tomorrow 7 p.m. is the topic which is going to be taken on the YouTube Let's Crack NEET PG channel, and that topic is nerves of upper limb, nerves of upper limb. So, this is the topic which will be covered, nerves of upper limb. This topic will be followed by a special class, special free session, and this special free session will be taken on the Unacademy app. So, for this you have to download the Unacademy app from the Play Store. You have to find your goal as NEET PG. So, my dear aspirants, you have to find your goal as NEET PG, and then you can use my code ANAT10. So, you can use my code ANAT10 to unlock, and you can be present for my free special class. So, firstly attend my nerves of upper limb ka session where I will cover up the theory part. This will be followed by an MCQ, or you can say like a quiz, which will be taken for 45-50 minutes. So, be present for that. So, and before ending the session, I would also like to tell you that, about the about the discounted rate of the NEET PG and Iconic subscription which is going on the platform of Unacademy, that is the Plus and the Iconic subscription. So if you are, it is already discounted at 10%, and by using my code, my dear aspirants, by using my code, that is NAT10, so more than 20% of discount is there. So if you want to take the subscription, whether it is Iconic or Plus, go for it and use my code NAT10 for getting additional 10% discount. Thank you, all the best, and we will meet tomorrow 7 p.m. YouTube session for nerves of upper limb, and nerves of upper limb followed by the special class. Use NAT10 to unlock, download Unacademy app, and 9:30 p.m. will be the MCQ session of nerves of upper limb. So this is the plan of tomorrow. So do present live. All the best. Keep studying. Thank you so much. Subscribe, like, and like the Let's Crack NEET PG channel, and do like, and on the special class you can also download the PDF notes. This is the special feature, and this is the benefit of joining the special class. All the best. Thank you so much. We will meet exactly tomorrow 7 p.m. All the best. Keep studying. Thank you so much. Thank you, aspirants. Thank you. Yes, thank you, fellow. Thank you. Thank you, everyone. Thank you, dear.